Welcome to our 34th Open Mic webinar. For this week, I'm substituting for Dr. Van, who is our chairman of the Medical and Scientific Advisory Committee. And the topic for this week is on innovation in the psychiatric medicine space. Here, I'll share with you a summary or an overview of what we discussed with the member of our leadership team. So I started out by talking about the definition of mental illness or psychiatric condition. Definition for psychiatric medicine, and also the topic we'll be discussing will be on the latest advancement and innovation in the field of mental health by leveraging technology, biotechnology, and novel therapeutic approach to improve the diagnosis, treatment, and the management of mental health condition. What exactly is a mental illness? A mental illness is a psychiatric condition or a condition has a negative effect on the way that an individual thinks, feel, and also behave. What are some signs of mental health or mental illness? This is change in a patient appetite or eating pattern, sleeping pattern, perhaps sleeping too much or too little, extreme mood swing, chronic low-grade depression, hallucination, delusion, also unhealthy coping mechanism like the use of alcohol, excessive alcohol or drugs, and also unusual emotional outbursts. Next, I went over the prevalent or the statistics for psychiatric condition in the USA, which is quite staggering. How prevalent are psychiatric condition in the USA? It is estimated on average 1 out of 5 Americans suffer from a serious mental condition such as schizophrenia, depression, or bipolar disorder, and that tally up to roughly 22.8%, which is very prevalent. Then shifting gears, I went over the various treatment, the most popular treatment for psychiatric condition. Now, shifting gears, we'll discuss the most popular classes of medication to treat various psychiatric condition. The most prevalent or most popular one is the SSRI or selective serotonin reuptake inhibitor. Serotonin, it is a neurotransmitter, and that is a chemical messenger in the brain that the brain cells use to communicate with each other. And the changes in serotonin level, it could affect patient psychiatric condition. So SSRI, it is designed to increase the level of serotonin for the brain cells to use. And this SSRI or the first line treatment for depression and also for anxiety disorder. Some of them include Prozac, Zoloft, Lexapro, and this medication, they're very popular. You see them on commercial. Another class of medication that are often used are the SNRI or serotonin and norepinephrine reuptake inhibitor. So this drug will put more serotonin in between the neurons or the brain cells to enhance the communication between the nerve cells. And this drug SNRIs are used to treat depression, anxiety, and also certain chronic pain can be treated with SNRI as well. Some of the examples of SNRI include Effexor and Cymbalta. Now, with the SSRI or the conventional medication, there are a lot of side effects. One of the key side effects is excessive weight gain. So there are atypical antipsychotic or atypical neuroleptics. These drugs have fewer or lesser side effects, and they are being used to treat bipolar disorder, schizophrenia, as well as being an add-on drug to treat patients suffering from depression. Some of these drugs include Abilify or Seroquel. Seroquel has good efficacy, but they don't have the increase. It doesn't have the increased weight gain like the SSRI. Other drugs, for example, a mood stabilizer, which include lithium and valproate, they are used to manage bipolar disorder. For ADHD or attention deficit hyperactivity disorder, they are being treated with a stimulant as well as non-stimulant. For the stimulant, this is a very popular medication, and they include the Ritalin or Concerta as well as Adderall. For patients who cannot tolerate the stimulant, for patients afflicted by ADHD, they are being prescribed non-stimulant, and this drug this drug includes Strattera, Intunif, and with ADHD, if the patient does respond well to a stimulant, the doc can treat the patient with a non-stimulant, and if the patient does not respond to one medication, doc then try another medication to see which of the drug that the patient best responds to. After that, I discussed about the novel trend or the novel treatment for psychiatric condition. The newer treatment that are more interesting, and some of these drugs are like esketamine or Bravado, and they are used to treat patients that have treatment-resistant depression. And these are patients who are afflicted by depression, but they don't respond well to the traditional drug like SSRI, SNRI, so on and so forth. So they are being given this novel or new drug. Other new treatment trends include like the use of app or digital therapeutic that help to manage various psychiatric conditions. Interestingly, CBD or cannabidiol, this is the compound that isolates from the plant marijuana, and they're being explored for treatment of various psychiatric conditions like anxiety, PTSD, also sleep disorders. Lastly, I share and discuss with members of our team on the prospective biotech investment opportunity in this space. Shifting gears, we're gonna go ahead and talk about the new trend that are more interesting part of our discussion. And as I alluded earlier, digital therapeutic is one such novel trend, and this is the use of software-based intervention, use of apps and online platform for CBT or cognitive behavioral therapy to manage stress, as well as for substance abuse treatment. Now, similar to the other trend in cancer treatment as well as other treatment nowadays, precision psychiatry is very important. The use of precision medicine, such as tracking biomarkers to help improve diagnostic and treatment, they tend to lead to less efficacy and the lowest side effect profile. Another big trend is the use of psychedelic medicine as a novel form of treatment. There are many companies out there that are developing psychedelic-based medicine for PTSD, for depression, for anxiety, and that has been a very hot trend in the past few years. Another big trend is the use of wearable technology for mental health, and for example, this wearable technology like the Apple Watch, so on and so forth, they can track the patient's sleep level, sleep pattern, also stress level, which is important indicator for a psychiatric condition. And with this wearable technology, since it's to provide a real-time data that would give the doctor and also the patient more information, more data for better treatment and intervention. AI and machine learning is very big nowadays in oncology treatment, other niches in medicine, as well as in the diagnosis and treatment of psychiatric conditions. If you enjoy our video, make sure you hit the like button, subscribe to our YouTube channel, share it with your friends and your family. Also, just tap, you don't have to smash on the bell notification button so that you can get our video as soon as they are released. Now, the other thing I want to share with you about is that our fund, we have weekly open mic webinar where our leadership team meet, and our chairman of the medical and scientific committee, that is Dr. Van Nguyen, he's a cardiologist, also medical director. And he and our team present on the latest advancement in the life science sector. We cover many niche, many topics, which allow me to gain an advantage in the life science sector. And in knowing so, I can fine tune my research position and invest in young innovative companies before they blow up big. Let us capture the tremendous upside in the biotech stock market that will occur in the next few years for you. If you're interested in learning more about our fund, you can check out our website, www.evergrowthinvest.com. You can also reach us by email, info@evergrowthinvest.com, or by phone, 704-957-7746. Reach out to us to see if we are the right fund for you and if you are the right investor for us.